Hello, welcome. You have made it to tonight's Can Do Multiple Sclerosis webinar on communication, intimacy, and sex, understanding and overcoming sexual challenges in MS. I'm Paige Kennan. I'm a programs manager for Can Do MS, and I'm going to be your moderator this evening. I do want to take a quick moment to thank our generous sponsors for supporting this year's webinar series. Thank you. I am so excited to introduce our two speakers for this evening. We have occupational therapist Joan Augustine out of Kansas, as well as psychologist Matt Sacco out of Ohio. Joan, Matt, thank you both so much for joining us.
Absolutely.
Awesome. Let's get it started.
All right. I'm going to go over learning objectives for today. So number one is to gain confidence in communicating with healthcare professionals and partners about sexual activity. The second objective is to learn about ways that MS can both indirectly and directly affect sex and intimacy. Matt and I will talk about both of those things in different ways. And then the third thing is to discover modifications for sexual satisfaction and function. So hopefully it will be a good program today.
All right, so some things to keep in mind as we go through this webinar. This webinar is designed for everyone, and everyone regardless of relationship status, gender, sexual orientation, any other likeness or difference you can think of as it relates to sex and intimacy. It's presented from a very clinical kind of biological perspective in many ways, because we do want to address sexual functioning and the effects that MS can have on that. And that, is, it doesn't matter, any of those other factors, orientation, relationship status, anything like that. So we will do our best to be mindful of as much of the gender neutral pronouns, things like that. And like I said, as clinical as we can. Take what information you'd like from the program. We know this doesn't every situation, every statement, every fact does not apply to everybody. We're going to cover a broad range of things. So please, what applies to you, what you can kind of glean and walk away from, take it. If it doesn't, just be mindful that it probably, with the numbers as I'm seeing on this webinar, over 300 at this point, it probably does apply to at least a handful, if not more, of other people that would like to get that information. So please, take what you want, what you like, and just, leave what you don't. We organized this in no particular order of importance or not. So we just want to start, though, with this, the concept of these challenges in communication. Talking about sex and intimacy in general, regardless of whether somebody has MS or not, it is a highly emotional topic. And it's often a very difficult topic to broach for many people. Some of that, as I said, even before MS, some of that may be based on how we are individually, we were brought up, how we were raised, how we've come to learn to talk about these things in general. There isn't a real great context for being able to be comfortable and practice these conversations. And so when something like MS affects a relationship, now we've taken a conversation that can be difficult to begin with and made it even more difficult, because now we can often talk about things that are maybe more difficult, makes people more vulnerable. MS symptoms change and can change all sorts of ways that we engage in sexual behavior. And to sit down and have a conversation with someone, to be open about it when it's already uncomfortable, it can be really challenging. So if you see that blue box there, one of the things that we want to emphasize here, we're not here to dispense any advice, to diagnose anything like that. I would encourage you it's hard to talk to your partner. It's important to also, though, include your healthcare team and your partner, because if MS has affected the way sexual functioning is occurring, or as we get into some of these other details, it can be really an uphill battle if you don't get some of those things addressed. And in many ways, you don't know what you don't know. And I will also say that just because you broach this with your healthcare team doesn't mean that they're going to be any more comfortable at times dealing with this stuff. So, in my own experience, I'm grateful for many of the nurses and stuff that I've worked with, because it's a good step into being able to have those conversations. So don't be surprised if the conversation can be difficult even with your healthcare team. All right, so let's get out of here. I like this breakdown here because we're going to talk about how MS changes sex and intimacy. It can affect feelings and responses. This idea of being directly and indirectly, both of these pieces are important. So when we talk about changes that are directly related to MS process or damage. Obviously, MS is a central nervous system disease. Most of the sexual functioning and response also occurs within the central nervous system, the spine and the brain. So anything that has more of that physiological consequence of the disease, where sex drive is diminished because of a disease process, or there's lesioning in a certain place, either in the spine or in the brain, that changes sensation. That's directly a cause of the disease. It changes those experiences. MS fatigue. This isn't the I'm tired, I don't feel like it. This is absolutely being completely wiped out, drained, that no nap or good night's sleep necessarily affects. So if you're feeling fatigued, it can be really difficult physically for sexual functioning, arousal, things like that, to even work properly. Spasticity, if you've got muscle spasms, whether it's your back, your legs, all of those which are potentially involved in sex, it's going to make it really, really difficult, and it's going to make it really, really uncomfortable. Included in that, sometimes spasticity and pain as well. Obviously people don't, pain is a signal that tells us to stop doing something. Unfortunately, with MS, the stopping doesn't necessarily alleviate the pain, right? So it's a signal for our body that says, don't do any more of that. And yet it's kind of confused because of the MS communication. So, that's going to change how people behave sexually and with intimacy. And then, of course, one of the more difficult things that people often have to address or have conversations about are anything related to bowel and bladder issues. Because obviously bowel and bladder issues, sexual functioning, it's all so closely related. And that's a very, very difficult conversation for many people to have. So those would be things that are directly as a result of the MS process, right? All of that stuff has changed directly. Indirectly, more of the psychological, although depression kind of sits on the fence of that too, because we know that depression occurs in people with MS at a much, much higher rate because of the disease process. But that's more of that mood component. And if you don't feel like it, you don't feel like it. And that's very, very difficult, because it gets, in our culture, in our society, it gets hijacked and it gets confabulated, and people think about, well, that mood and just not wanting to, and it becomes this stereotypically like manipulative thing in sexual relationships that it really, really changes how people feel about themselves. If you're anxious about bowel and bladder issues, that's going to interfere indirectly, because it's going to start to mess with how you feel about yourself and your ability to function. Take a step down to body image, right? The body changes as a result of, be it spasticity, be it loss of muscle tone, you name it. Body changes anyways as we age. So if you're having difficulties with MS, it can be very, very difficult to have a positive or favorable body image. And it's hard enough in our culture and our society based on what we see. So they can really get compounded by this, and then lead to people feeling angry. Oftentimes, anger is the only emotion that is more socially acceptable for men to express than women. So women can express all the other emotions, but anger is one that they can't. And men are apparently, that's the one we're given to be able to express. So for men, oftentimes when things don't work well, it can come out more directly as anger. Of course, that doesn't mean that women don't experience anger. It's just how it's often accepted to be expressed. So oftentimes with women, it can be internalized or come across in other ways. So clearly, this is going to have a drastic impact on just how you feel about engaging in sex and intimacy.
I think what you said, Matt, it's just good. Like what you're describing is complicated. You know what I mean? Sex is complicated in general, and then MS kind of adds to it. So I just think it's good to keep in mind that it's complicated, but we can talk about it. And there are people who want to talk about it, even if it's not you and your partner right now or you yourself, it doesn't matter. But just saying that out loud, that it is complicated and that's okay.
Yeah, yeah, absolutely.
So I'm going to talk a little bit about the difference between satisfaction and function. They are two different things. So function, can relate to sexual desire, arousal, orgasm, and those are basically, if you want to think of it as, oh, those are systems that are affected. So kind of like what Matt said, and we talked about it before, obviously, that when you have a system change, that's relates to a function change. So he's mentioned spasticity, sensation changes. MS fatigue is different than fatigue, for someone who does not have MS. So those functions can be affected, by MS, but the functioning, the systems that are involved in sex is a different thing than satisfaction, which is really how you feel about the frequency and quality of your sexual interaction. So he already mentioned too, sometimes that involves mood. It might involve how open you are, if it's just you or if it's you and a partner. The openness, communicating about that. Confidence, I've kind of seen in the chat, quite a few people have commented about body image. If you don't feel confident, or if you're having a sexual act with a partner and, that person doesn't feel confident, that's going to influence satisfaction. So just knowing that those two things, they can go together. You can have function that doesn't work and then you're not satisfied. It's also tricky sometimes when everything is functioning okay, maybe, and then you're still not satisfied. It's okay if it's both or it's one. It's good to talk to your healthcare professional if it's a system or function issue or if it's a satisfaction issue. So I don't know if you have anything to add, Matt, on that.
Yeah, I really like how you said that. And oftentimes when I have these conversations with people, because it's very difficult to articulate what we mean when we talk about function and satisfaction. So one of the simple ways I often ask people is like, function really relates to is, okay, let's say everything is everything is in perfect order. You're good to go. That everything works properly, right?
Right.
All of the sexual functioning, everything works. All of the systems work. No problems. That's function. Like if you wanted to, you could, and it all works okay.
Right.
Right. And you can very easily see how MS, when we know that, changes a lot of that. But that is different than that satisfaction with not just the experience, but frequency and quality. Again, issues that can have nothing related whatsoever to MS and are issues that couples deal with all the time.
Exactly.
So we just are now talking about the added, pain that MS often throws into the mix of it.
Yes. So who can help? I have also seen in the chat a lot, like nobody ever asks. And I'm so happy because that's why I wanted to join this webinar. And I'm so happy to be here with Matt. Please, you guys ask, even if you're a healthcare professional. I saw in the chat, someone was like, they're awkward about it. Well, let them be awkward. It's their job to address. And the truth is, you may talk to a professional and they don't know what to do, but what they should know what to do is to refer to someone. So I've had some people bring up issues that I'm like, man, that is a great concern, in terms of what you told me. That makes sense. Let me ask a psychologist about it. Or, hey, I used to work in a community center who served people who have MS. It'd be like, let me talk to our social worker about who she can connect you to. But in a second here too, we'll give you a tool that you could even fill out beforehand if you'd like to give to a professional. But please ask. I think that's one of the biggest things, and you guys have said it. Please ask that person. And I see some comments rolling in now, like a neurologist said, yeah, that happens. It's like, okay, maybe that's not the professional. I mean, maybe you ask someone else, or ask have a follow-up question and say, yeah, it does. Who's someone you know who could help me out with this concern? So our hope is just, I'm an OT, Matt's a psychologist. I feel just fine talking to people about it. I know not everyone does, but please keep asking. I hope we have professionals who keep asking. It's an important function of daily life.
Yeah, absolutely. And again, if you're not finding that in the system that you're working in, you certainly are in the right place now, right? You're taking advantage of some of this programming. The National MS Society, and they have resources in their MS navigators to be able to get you connected to people who have maybe a better expertise, or one of the ways that I often describe it is just more fluent in the verbiage and the language of MS, and that can make a pretty big difference.
Yes, absolutely. So here, when I was at the CMSC, the consortium, I went to a presentation by a psychologist. I think Matt knows him. He was awesome. He shared this questionnaire. It's called the MS Intimacy and Sexuality Questionnaire. This is just part of it. It's 19 question items. And you can see on here, Paige also just put it in the link in the chat if you guys would like to access it. And I think she's going to provide it as a resource later too. But like number one, muscle tightness or spasms in my arms, legs, or body, you're going to put over the last 6 months, has that related or interfered with your sexual activity or satisfaction? And then you can kind of see across the boxes, 1 is never, up to 5 is always. So those are just 7 of the questions. Like I said, there's 19 that relate to kind of what we were talking about in terms of both system and function questions, as well as how you feel about it, the satisfaction part. So for some of you who were asking, how do I ask about this? This is weird. It could be cool to have this pulled up, either on your phone or something. I think they have a PDF you can fill out. If not, maybe you could find a way to print it and take it to your provider and say, I filled this out, out of recommendation from a webinar, through Can could you help me with maybe who could help me with some of these questions? So hopefully this will be a good resource for you guys in the future if it's a concern for you guys.
And so, if you're again, as Joan said, this is just a cut from the assessment. There are 19 questions on it. So the link that Paige gave you. So if you're having difficulty figuring out, well, how do I get this? You can always load it onto your phone and take a screenshot. Okay. And I think one of the coolest things about this, and this in particular, is it's great, of course, if you fill it out and you take it to your provider. But even a step back from that, it's great to fill out for yourself to understand where your problems lie, right? What
Yes.
issues am I having? Oh my gosh, I didn't know these things could affect sex and intimacy. And it can be an awesome tool just to start for yourself to better understand how your sex and intimacy lives are affected by MS.
Yeah, that's a great point. Because sometimes, we just feel unsatisfied. And when someone asks us why, you're like, I don't know, I'm just angry. So I think it's good to have, that's a great point. Even if you pull it out for yourself, that's a great way to look at it as a tool.
And I'm sure if you're not sure how to do a screenshot, there are people in your world who can help you, young people in particular, who are sitting in the doctor's office who might be more than happy to help you figure out how to take a screenshot and go through that. Let's see. All right, so I want to talk a little bit about relationship changes. Relationship is a broad term. Oftentimes, I think we jump right away to, when we start talking about sex and intimacy, are close partnered relationships, which that's a significant chunk of who is affected by this. But obviously, sex is not specifically, especially the physiological functioning of sex, is not specifically confined to being in a partnership. So some of the idea of understanding whether the sexual systems are working, functioning, it doesn't require a partner. So you can figure some of those things out, or if you're not with a partner, it doesn't mean that you're asexual and are not engaged in any activities, sexual activities whatsoever. So it's important to be mindful of that. But when, for the sake of where we're at at this juncture, we're going to talk about the changes in roles, right? So oftentimes, depending on how much MS has impacted or affected a person's ability to get through their daily activities. It could be mild. It doesn't have to be much at all. It also could be some just little things, little bits here and there where it can start to seem or feel like a disproportionate amount of, whether it's household responsibilities, childcare responsibilities, job responsibilities, whatever, it starts to shift. Okay. So it doesn't mean that in a relationships are always 50-50 by any means. I will often use the image that relationships are like sitting in a small rowboat or a canoe with somebody, right? And if one person's seated and one person has their foot in the boat and one on shore, you're not going to go anywhere, right? But the idea is the relationship starts with both people seated. Then you got to figure out, okay, where are we going? How do we row together? And sometimes one person does row more than another. It becomes a challenge or frustrating when that seems to go on for a longer period of time. And one person, because of a lack of communication, because of a lack of, really working through this, one person starts to feel like this shift is making it really overwhelming. And that idea of who becomes responsible for tasks. And at times, depending on the MS and the severity, one person in a relationship can often start to feel more like a caregiver. And in fact, in many instances, does take on more caretaking responsibilities. That really emotionally can have a pretty significant toll on, especially that feelings of intimacy, and shifting from a partner and a sexual partner, a sexual being, to a caretaker can really be difficult. And it's even more difficult when there's a lack of communication, a lack of being able to dialogue about it. So this is just a simple snapshot of how quickly MS in and of itself directly can affect a partnered relationship.
And Matt, I just want to jump in real quick because I saw in the chat, there were some people commenting about like, I do feel like my husband or my partner has become the caregiver. Maybe you'll answer maybe some ideas for those things in the next few slides. But I just wanted to bring that up, that I think that's come in through the chat and just might be good to talk about if you have any ideas now or kind of coming up in your next few items.
I'm so glad that you pointed that out, because I think that it can be lost in this, which is we often think about it from the sex and intimacy, and I probably even verbalize it this way, that change, the person who's doing the care, who has more caregiving responsibilities, the one who's like saying, okay, I'm feeling worn out by this. But the fact is, the person who is seeing that change and feeling like that they're, either becoming more of a burden or their partner is doing more, it equally, if not more, affects their own psychological kind of component to this. So that simplistically, and I know we'll get to some more of this, the simplest, and it's not always easy to do, but it's very simple, would be to get a therapist or a psychologist on your team. Doesn't have to be a doctor level psychologist. There are awesome master's level therapists and social workers who do this work, but someone who is licensed, someone who might have a little bit of experience working with either folks with MS or more broadly working with people with chronic health conditions. Those are the kinds of things. But I will say, it does, just as my boat analogy says, it takes both people being seated in the boat for it to work. You don't have to be rowing, but it takes you both seated for the relationship to go. If one person isn't, part of that task may really just be getting that person back in the boat.
Yeah, and that makes a lot of sense. And I see in the chat too, just people talking about like, hey, I feel guilty, or maybe I think there's some shame around that. I just feel I agree with what you said, Matt, like have somebody who's licensed to maybe speak with about that, because, if you're feeling that shame and guilt, one, your partner may know it or they may not. And if there's not someone I always kind of describe therapists as neutral. Hopefully they're that. But I mean, that can kind of talk through it in a neutral way. They're not in the relationship. I just want to say, I think that's just a great advice to try to bring somebody on your team.
And also, when it comes to a lot of times, and I'm really encouraged more and more as I do these programs and work with people who have been working with therapists, and it's great. This is a phenomenal thing to do. Just I would say this. If you have your own therapist, don't use that person for your couples therapy. Okay. Get the relationship needs its own therapist, because by default, and just with something that you said, Joan, that made me think about it, which is it's not going to feel neutral when one person goes in and sits in the therapist's office with their partner who's been seeing that therapist for
That's
years.
so true. Oh,
So
that's so true. I'm glad you said that. I wasn't thinking of it in that way, but you're right.
yeah,
That's such a good point. Yes.
yeah. So and they're out there. So this kind of shifts us a little bit into the okay, well, what's one way that we might be able to start to tackle some of this stuff, right? And this is just a real basic, simple approach. I planning a date night, right? Gosh, this is such a common uh, thing that I hear. And we hear it on just kind of on in media, on TV. It's always, oh, you know, especially when you start talking about, you know, people who have families or have other responsibilities, and you're going 1,000 different directions, and the idea of okay, well, wait a minute, I have to have a date night. Like that is, it seems silly to so many people, and it is not unique to having a chronic illness where this becomes important. It's more about the effort, right? When people feel like in a relationship that the other person or each person in a relationship is putting forth effort directly dedicated to that relationship, it can make a big difference. It often does. There's a certain amount of being thoughtful about it.
Yes.
I will say this: if you're with somebody, and I kind of have these conversations with my own wife at times. You know, we have kids, and they're getting a little bit older now, but when they were little, going out and leaving the kids with anybody was not a relaxing evening for her. So like there was no amount of let's go to the movies, let's go. It was not going to be something where she felt like she was able to relax and de-stress and not be worrying about what's going on at home. Okay, so those are the little things that you kind of have to know, that it may be great. I love to go to the ball game, but if somebody has difficulty navigating a stadium, like that is not going to help the process. So it's
Yeah.
this idea of finding an activity that makes both people feel connected and good, and not, you know, if somebody wants to spend quality time and there's none of that, let's like I say, going to a ball game or whatever it might be, you've got to try to find something that matches. Um, Going to a new restaurant, going out to eat. If you're constantly in a position, which I hear over and over, where the first thing, especially if you have bowel and bladder issues, is you start looking for where the bathrooms are when you go into a restroom or a restaurant, and you're trying to see, oh my, okay, so how close do I need to sit, and is it accessible? This, that. I mean, right away, that just kind of cuts the momentum and the feel good kind of
The joy.
nature. Yeah. So it doesn't mean though that you shouldn't try to make a special attempt. Make dinner at home or order in, right? You can watch it, going to the movie theater. Like that's not, I'll be honest, I don't like going to the theater. Like I haven't gone to the movies besides when I see the ticket price. Like I'm like, God, like I don't, this is not enjoyable for me. But I would love to watch a movie at home. Like for me, that is far more enjoyable. So knowing your partner, right? Knowing what they like. There are some good, if anyone is familiar with Gary Chapman and the Five Love Languages, use those texts a lot. It's really about understanding what I describe as the currency in communication for your partner, so that you're able to speak or do things in their currency, something that's valuable to them, and it makes all the difference in the world. So try to find little ways to meet them there, whatever it is. And some of it might be just sitting down and having that conversation about, okay, this seems kind of silly, but we were talking about it. This is the seminar. Let's talk about some things that we both might like to do together that we're comfortable with. What I see some stuff popping up,
Yeah.
picnic on the floor. Like, talk about it and then do one of those things, because you're
Yes.
both putting forth the effort to make that happen.
And know that if your MS has changed some of that, that's okay. Do you know what I mean? Like somebody put in their redefining expectations. You can talk to your partner about that. Oh, I saw a page popped on. I'm sorry. Go ahead, Paige.
No, thank you. This is all great. I've just had some people reach out and ask if I don't have a partner, is a date night beneficial if I want to go on a date night by myself? Does that help?
The answer to that is if you want to, yeah. Yeah, absolutely. If it's something that you want to do, it's meaningful to you, I say that because sometimes people feel like, oh, they have to because they're single or because, but if you like that kind of thing and it's enjoyable as much as it is, yeah, it does, depending on what you may have to deal with from an MS standpoint or whatever it is. It may also require a different type of tweaking things because obviously if you're going on a date with someone that would be at least a little bit easier perhaps in terms of figuring out where to go. If not, you just have to kind of keep in mind what your level of comfort is, what you feel like you can do, and still enjoy yourself. That's the big part. You still want to enjoy yourself. You don't want to kind of be constantly looking over your shoulder or worrying about stuff. That's not going to be any fun.
Right. I agree. I think anything that brings you joy and is going to be fun and safe for you. Absolutely.
Great. Thanks, guys.
Hmm.
Was this still me?
Yep.
Oh, okay. I was looking down at something else. Okay.
All
So
good.
that's that other slide was the idea of what we're talking about, just kind of planning for dates. So that's fits kind of just more in a broad kind of intimacy category. You need to do the same thing as it relates to planning for sex. Again, not chronic illness defined. If you've got other things going on in your life, you have kids, you have work, you have whatever it is, my gosh, it seems, I know some people have such strong reactions to this. But if you're talking about wanting to put effort into improving the quality and satisfaction of your sex life, then especially if it has changed, then probably it makes some sense that often you kind of have to put the effort in. Reducing distractions, it's just the simplest thing. Putting the phones away, turning the TV off, whatever it is are the distractions for you. Because when you're trying to, set up, let's just say, a plan for sex, doing so as you look at a week or a calendar at a time that it's like, okay, this is gonna be the day, this is gonna be the time that we're gonna give this a shot because it seems like it's the best thing. There's nobody, the kids are out of the house, or we don't have this, whatever it is. But also, the interesting part is having that plan or having that on the calendar. Oftentimes, yes, it can, if we're tackling a lot of these different things, it will help reduce some of that anxiety. But having that on the calendar, oftentimes can become this playful thing to look forward to. So as a part of that process, putting forth the effort, putting forth, showing that other person this is important enough, and I'm gonna put work away, or I'm gonna do this, or I'm gonna, really try to optimize the environment, whether it's, if you like candles, light a candle, whatever it is. But that effort can go into making this a much more enjoyable, versus okay, 10 o'clock on Tuesday. Like it can kind of seem sterile. Not that works, but it's the effort, it's the whole totality of it that can be really helpful. If you're taking medications that interfere with sexual functioning, or more specifically, if you're taking medications that make you tired, fatigued, a lot of the medications for spasticity, things like that, often have the side effect of being really sleepy. So trying to figure out when you can coordinate and take those to have the least negative impact on sex, right? That's the sedating piece. Trying to plan like it's times when you feel more optimal. If you know that, like, just in general, you're not a morning person, well, I'd probably say that trying to plan for sex in the morning, it is like swimming upstream, right? Like it's just not a good idea. So looking for those times where you actually feel your best. It doesn't mean you feel optimal, it doesn't feel great, but when you may feel like this is the time that I'm actually functioning at the best. And you know what? Just like any other time in any other situation, you could have your best laid plans. You could have all this laid out and something happens. And it'll need to be rescheduled. If you have an open dialogue about this, if you are, you know, both preparing for this and putting for that, then these kind of things won't be as big of a deal because you're already having that conversation. And if something comes up, then you talk about, okay, let's reschedule. So the more you do this, then the more each person is going to be able to say, okay, I know, we'll do this again. We're going to put this together again. This was actually kind of fun to put all this stuff that you can kind of get right back on track. But when you come at it with an approach of feeling like completely dejected and disappointed and throwing in the towel, it's going to circle back around and make it more difficult next time. And if you haven't had that open conversation on the front end, it is going to be really difficult to deal with some of these disappointments that just come up. Life just happens. MS or not, it just happens. So being flexible is an absolutely huge benefit as we start talking about this stuff.
That's a great way to lead into modifications, just because I do think planning and time of day is a modification. I also wanted to follow up with what Matt said about, your optimal time of day. If you don't know that, that can be a good first step. Hey, like I have no idea when I feel the best. Some of you guys have been commenting like, you know exactly when you feel the best, if it's when you take meds or day or night, or I know here in Kansas when it gets real hot, sometimes that's really difficult for the people I've served who have MS. But if you don't know, that's a good first step. And then that can be a conversation starter, if you are intimate with a partner. So just know that that could be a good thing to talk about. Hey, actually, I kind of thought about it, or I realized I feel the best at this time. Otherwise, I'm going to go into some more modifications. As we said, arousal and sensations may change with MS. I know we've talked about spasticity. There's a lot, there can be nerve pain. Someone mentioned in the chat, numbness is there. We didn't put that on the slide, but absolutely that can be a thing. And it can be some relearning of how, when, and where you like to be touched. So if you had a certain place that you like to be touched in the past and that doesn't work anymore, it may it may be you yourself discovering that, or you and a partner discovering that if you're with someone. That changes, and that's okay if it changes. You might just need to kind of have that self-awareness time, do you know what I mean, where you figure out, okay, where do I like to be touched now? And that can, from some people I've worked with in the past, that can be exciting. You know what I mean? If your partner is willing to talk about it and try it. And then I know that some people on this webinar, we've got quite a few. If it's within your belief system, if you're cool with that, you can look at adaptive and accessible sex toys. Those are different ways that you can increase stimulation or arousal, just different ways to kind of make you feel good. If you're not open to that, that's okay. We're not pushing that, but our job as health professionals is to kind of expand some ideas. So if it's in your, belief system, cool. If it's not, you don't have to take that, but you can Google things like adaptive or accessible sex toys. There's a lot out there. There are aids for things like lubrication, obviously, but also things like spasticity concerns. There's different aids that vibrate or don't, or they're differently shaped. And they also make toys and aids that can relate to if it's difficult to grasp something or your grip strength has changed. I mean, you don't think about it all the time, but that relates to sex. And if, it's a concern, there may be an aid to help. So just know that we're mentioning those things because they can be helpful tools. And then lastly, I don't feel like you can get away with talking to an OT unless you're talking about bowel and bladder. It always seems to come up. We love, I guess, to talk about it, but it's also important to talk about regarding sex. Continence, or basically, urinating or having difficulty urinating, can be embarrassing to have to think about before or after sex. I saw in the chat someone mentioned, UTIs are a concern. Some people suggest, like making sure you can urinate after sex can help with UTIs. But so maybe talking to your partner about that. But, it's not fun to think about, but it could make the process more fun if you do beforehand. And again, this may be if it's by yourself, you're doing something solitary, you got to kind of know when you should do that. But if you're having sexual activity with a partner, you got to talk to that partner about it and be like, hey, I think just laying it out sometimes, like, we've got to think about it, because you know what is worse, and I've had people experience that, is if you urinate during sex, well, that can be more embarrassing than talking about it beforehand. So just being in clear communication with your partner, if you're having sex with a partner. Things to try, modification wise, you can also look at, towels, or they have those cover sheets to protect your furniture, or bed and your sheets. You can schedule time to urinate or void before or after. Sometimes, people kind of know, usually I have a bowel movement at this time, or I have a bowel movement, once every 2 days or whatever it is, and try to plan, if you're going to look for sexual activity around that time. Something that came up a lot in the clinic I worked at, I know we're getting close to our question and answer session, so I'll try to wrap up, but it's come up a lot, is catheter use. So I know some of you may have catheters, suprapubic or Foley catheters or otherwise. Just knowing that you can still have sex if you have a catheter. You may have to talk to a neurologist, or I'd say a urologist, as some of the participants I work with usually have better a better conversation with the urologist, just because it's their kind of focus. But they can be secured during sex. If you self-cath, you can self-cath or void before sexual activity to kind of know that that happened beforehand, so you don't have to have that as a concern. But they can be, like I said, secured. It is possible. And some people I've worked with, like, there are partners, if you're having sex with a partner, that are willing to have sex with a catheter. So just know that, again, I think if I could like blast the message out in this webinar, it would just be like, please talk to a healthcare provider. You know what I mean? If you don't have a urologist, maybe see if somebody could refer you to one if you're concerned about catheter use, or voiding and urinating. I know it's not fun, but it's important to consider, because it could make the whole thing, when we're talking about satisfaction, just more satisfying. So Matt, I don't know if you have anything to add on that. I know we're getting close to question and answer time.
No, I think you covered it. I think the conversation is important, where it's, some of these things, when you start talking about whether it's UTIs, potentially things like that, it is in addition to, it's your health, it's your life, right? So the conversation, while difficult, in terms of big picture, that's the simpler of the things to do and not have significant consequences.
Yes.
Awesome. We've covered a lot, and we have lots of questions, so we will try to answer as many as we can in the next 10 minutes.
Okay.
All right. Oh, I'm going ahead. I'm going to stop sharing for a second so we can see each other. All right. So, Joan, you did touch on this. I just want to bring it home because we did have a lot of questions around it. With a UTI, are people more susceptible to getting UTIs due to having MS? Or because of certain treatments they're taking, and then how do you avoid it? I know you touched on it, but I just want to make it super clear.
Sure. I'll say what I know, and then Matt, you can add in, because some of that I'm not totally sure. I'm not sure if MS relates to more UTIs. I don't have that information. I do know some people I've worked in the past have told me that some of their meds, their doctor had told them that some medications for MS can relate to more UTIs. I think that's common. I do know for sure, if you have catheter use, that UTIs can be very common. So a lot of it, I'm not going to say all, but some of it would definitely be hygiene, making sure that you're cleaning properly after you have a bowel movement or you urinate. And then, like I said, that actually came from a urologist that told one of the people I worked with that try to make sure you urinate after sex, to make sure that prevents UTIs some as well. Matt, do you have more information on it? That's kind of the breadth of my knowledge on
Yeah,
that.
I think that for all of those reasons you said, in addition to any time you start talking about MS causing, in this case, bladder issues, and it makes it difficult with urgency or constancy or voiding, whatever it is, yeah, you're going to be more susceptible to UTIs. It's just,
Right.
if you're having difficulties passing urine, and it's either staying in your system longer or whatever. And of course, in addition to that, the hygiene piece. So yeah, absolutely. When you have those issues going on, you're much more susceptible to UTIs.
Great, thank you for clearing that up. We've also had several folks talk about during orgasm, it really triggers spasticity, in particular during orgasm. Is there anything that they can try or do to maybe avoid that?
Hmm.
I know it's difficult.
Well, I think the one thing that I would say would be, you know, first of all would be, depending on the person, what spasticity is being triggered, right? So if you have a particular muscle group that is vulnerable to spasticity, and that's what we're talking about, the simplest thing I would say is trying to control positioning for how you're positioned when that happens, when you orgasm, so that you're reducing any potential, I guess, worsening of that spasticity. So in terms of actually, you know, reducing the spasticity as a result of orgasm, I don't know. I mean, I don't know
I
what I would suggest there.
I've had a few people, and somebody put that in the chat. I've heard that there's like some of the sexual aids or toys that are vibrating. Like if you or your partner, if you're having, partner sex, can control it, and when that aid vibrates, if that makes sense, can sometimes control the spasticity. So I have heard that before. Um, like you said, Matt, I think positioning is big. It kind of depends exactly what you said. Where are you having the spasticity? Do you know what I mean? Is it in your legs? Is it, do you know what I mean? Because I think, your arms, where is it? Because that might be a big positional thing. But and again, I know not everyone uses aids, but somebody put that in the chat and made me think. I had a person talk to me about that once, that maybe if there's some kind of aid and when the timing of that happens, with orgasm, that might help. That might be something to follow up on, though. That's a great question.
Yeah. I saw that somebody said that they asked their partner for massages leading up to
Oh, there we
sex,
go.
which is fun for all sorts of different.
Yeah. Yeah, someone else said stretching before.
Yeah,
I think that's a great idea. I definitely have had people do that. Like if you're tight, try to stretch before. That's good. Looking at the chats, a lot of the answers, but yeah, it's a good
absolutely.
question.
I mean, and a lot of these things, they're kind of trial and error, right? Like there's never going to be an answer for one thing, and it's kind of learning your own body.
Yes.
So I also have somebody who is having a hard time talking to their partner. We talked about how sometimes our healthcare providers can be a little and awkward about things. How do you, sit down and have those conversations with a partner who just doesn't feel comfortable having those conversations?
Uh, uh, that's a great question. So there are a lot of ways, actually. One of the things, just based on what we talked about tonight, that um, little survey, the questionnaire that was posted about the early on the MS, what is MS-19? Is that what I'm trying to get the name of it right? But you can use
Yeah.
that and have that conversation with your partner, right? That could be an opening, whether it's letting the, filling it out and letting them look at it as well. Otherwise, I think that, you have to kind of, I would say, it's kind of nibble away at, whatever your communication style it is, whatever way it is that you feel like you can kind of start that conversation. Communication is a two-way street, though, right? That's the bottom line is, and if it's important to you, then kind of broaching that conversation, having those discussions, and ultimately, you certainly could do that. You could do that with a therapist saying that, but I will say this: if you're with somebody who is has difficulty having the conversation one-on-one, having the conversation in a therapist's office probably isn't going to go a whole lot better, because it's already an issue, and doing it in front of a quote stranger is gonna, it's just not ideal. So and I don't know, start with the questionnaire. I mean, we've have the conversation bring it up if you're at a doctor's appointment, say, hey, this is an issue, and talk with your neurologist and maybe let them hear it, you know kind of secondhand. Or we just did a whole webinar. So this would be a place to kind of point them to see, oh my gosh, there are a lot of people who this is an issue for. Maybe this is a good way to at least get some knowledge under my belt before I have that conversation.
Absolutely. And as a reminder, this is recorded and it's going to be available tomorrow and on our website from here on out. So great resource. As our final question, we have different people asking kind of the same question in a different way, talking about having problems with orgasming or this fear of failure. What if I don't orgasm? That's embarrassing. Is it something physical that happens to me? It's kind of a loaded question, but can we just talk a little bit about the lack of orgasm when you're engaged in sex.
Yeah, so I think that unfortunately we have this is a huge issue as it relates to what we're kind of socialized to believe sex is all about, right? And so that's the biggest issue, is that from the time we're even learning about sex, and to what extent we're taught about sex, whatever it is, right? That this idea of orgasm is the absolute most important part of sex, and that's where the problem lies, because then you get stuck on the only way that you can either be successful or whatever word, like to actually have I'm trying a blank on any other words, but successfully kind of complete sex, that has to occur.
Like
And
for it
that
to
is
be
so
pleasurable.
yeah, and that
Yeah.
is so far from the truth.
Yes. I think you're right. I think sometimes there's that. I mean, of course, I'm sure, orgasm is great, but I mean, there can be pleasure and joy in sex without it. And maybe kind of like what you've said, Matt, like being able to talk to your partner that, hey, some things have changed. It may not happen every time, and maybe we can enjoy it in a different way if you are having partnered sex. So, I agree with you. I think there's been kind of that from early on. I'm sure it depends where you live, but I mean, just your education in sex to start kind of puts the focus on that only. And I don't know if the focus only has to be that.
And it's also from an early age, it's so gender different, right? That it's like men have dominated in terms of the kind of the sexual discussion, and that's who it's all about. And that's where kind of the way this interestingly can work more effectively is those, if you're having difficulty, those conversations about other ways to enjoy sex and all that kind of intimacy, things like that, are probably more the solution to this orgasm problem, if it's something that is not a disease process or whatever it may be. That having that intimacy, rebuilding that, and having that connection is going to go much farther to this idea of being able to solve any orgasm problem than really any other intervention is going to whatsoever.
Yeah, thank you.
Makes a
I
lot
know
of
we could
sense.
go on and on with these questions. So I do want to point out, if you haven't gotten your question answered today, again, we have that jumpstart coming up next week on Thursday. You can also feel free to email us, whether it's about sex and intimacy or any topic. If you have questions and you can't get an answer, we're gonna give it a shot to answer it. So go ahead and email us at info@cando-ms.org. We're always happy to try to get your questions answered. But back to you, Matt and Joan. We have about a minute if you want to tell us what you've taken away from this today.
Go ahead, Joan.
I think my big one is the second bullet, and then Matt, I'll let you go. Is just that there are healthcare professionals who care and who want to help. Not just Matt and I, but I know there are other healthcare professionals, and my hope is that if you bring it up and maybe don't get the answer, they could refer you to someone else. So my biggest takeaway is please ask. I can tell from the chat that there's a lot going on. Things are complicated and things are tough. But please ask, because there are people who care. That would be my takeaway.
And I'd say for me, this idea of recognizing that you have to be deliberate, conscientious, and intentional about this stuff. For most of us, when we're a lot younger, and just this idea of just jump into bed and everything works and it's no problem. Like life happens, things change. MS changes things. It's effortful, right? It's effortful to have those communications, those conversations. And I would also say that for most people, that effort it's worth it, because it will help build intimacy, and ultimately it could change your sex life. But it's that intimacy piece that can make all the difference in the world.
Totally agree.
Thank you, Matt. Thank you, Joan. Thank you
welcome.
all for joining us today. Please connect with us on social media. If you're on any of those platforms, we provide resources, news, upcoming events, those types of things. We also want to send out one last huge thank you to this year's webinar sponsors. Thank you guys so much for being here. Have a great evening.